content provided in this dental reviewer is if for educational and informational purposes only. It is not affiliated with, endorsed by, or officially recognized by the Professional Regulation Commission, PRC, the Board of Dentistry, or any official licensing body in the Philippines. All questions, explanations, and materials in this reviewer are generated using ChatGPT and are based on general dental knowledge, textbooks, and publicly available resources. This reviewer does not contain actual board exam questions and should not be considered a guaranteed way to pass the dentistry, dental technology, or dental hygiene board examinations in the Philippines. While we strive for accuracy, we encourage viewers to consult official references, textbooks, and review centers for comprehensive preparation. The creator of this content is not responsible for any errors, omissions, or exam outcomes based on the use of this reviewer. By watching and using this material, you acknowledge that it is intended as a study aid and not as a substitute for professional education, training, or official review courses.
Enumeration Review. Topic: Oral Physiology, Part 1.
The study of normal processes in the human body without disease. Answer: Physiology. The study of processes occurring in the human body in the presence of disease. Pathology. The system of bones, muscles, teeth, and soft tissues that allow chewing. Answer: Human masticatory apparatus. The system of muscles, joints, bones, and teeth involved in chewing. Answer: neuromusculature, temporomandibular joint, TMJ, bones, dentition, teeth. The components of the temporomandibular joint. Temporal bone, disc, nerves, condyle, ear canal. A joint that allows movement of the lower jaw, mandible. Answer: TMJ. A structure that does not allow movement and aids in brain development. Sutures. The fifth cranial nerve responsible for sensory and motor functions in the face. Trigeminal nerve, mixed nerve, sensory and motor. The main control center of the human masticatory apparatus. Answer: TMJ. A structure in the masticatory apparatus that cannot be repaired if damaged. Answer: neuromusculature. A structure in the masticatory apparatus that can be repaired if damaged. Dental components. The major functions of the human masticatory apparatus. Answer: mastication, deglutition, speech, respiration, defense. The minor functions of the human masticatory apparatus. Answer: active eruption, passive eruption. The movement of a tooth from the bony socket until it meets its antagonist. Active eruption. The three phases of active eruption. Pre-eruptive movement, eruptive movement, post-eruptive movement. The movement of teeth before eruption. Pre-eruptive movement, the functional positioning of teeth in occlusion. Eruptive movement, the compensation for wear or loss of teeth. Answer: post-eruptive movement, the effect of congenital syphilis on teeth. Answer: Hutchinson incisor, the natural wearing down of teeth due to chewing. Attrition, physiology, the grinding of teeth, usually unconscious or during sleep. Answer: bruxism, pathology, the natural process of losing primary teeth. Answer: exfoliation, physiology, the removal of a tooth due to disease such as caries. Answer: extraction, pathology, Inflammation of the gums. Answer, gingivitis. A disease affecting the bones supporting the teeth. Answer, periodontitis. The process in which a tooth erupts beyond the occlusal plane. Answer, supraerupted. The gingival margin follows the eruption of the tooth. A periodontal growth. The gingival margin remains at its original level while the tooth erupts. Active eruption. The gingival margin recedes while the tooth stays in position. Answer, passive eruption. The parameter of eruption that answers the question when a tooth erupts. Answer, time of eruption. The parameter of eruption that answers the question what tooth comes first. Sequence of eruption. The physiological breakdown of roots as a natural process. Resorption of primary teeth, the formation of bone. Bone deposition. The consequence of resorption of primary teeth causing the bone to lose support for the teeth. Answer, exfoliation. The number of primary teeth in a full set. 20. The number of succedaneous teeth, permanent central incisor to second premolar. 20. The number of accessory teeth, third molars. Conditions that prevent exfoliation. Answer, absence of teeth, wrong direction of eruption, injury to bone, crowding. The eruption age of the primary maxillary central incisor. Answer, 8 to 12 months. The eruption age of the primary maxillary lateral incisor. 9 to 13 months. The eruption age of the primary maxillary canine. So 16 to 22 months. The eruption age of the primary maxillary first molar. Answer, 13 to 19 months. The eruption age of the primary maxillary second molar. 25 to 33 months. The eruption age of the primary mandibular central incisor. 6 to 10 months. The eruption age of the primary mandibular lateral incisor. Answer, 10 to 16 months. The eruption age of the primary mandibular canine. 17 to 23 months. The eruption age of the primary mandibular first molar. Answer, 14-18 months. The eruption age of the primary mandibular second molar. 23 to 31 months. The age range for primary dentition. Up to 5 years old. The age range for mixed dentition. 6 to 12 years old. The eruption age of permanent dentition. 13 years and above. The sequence of primary dentition eruption. Answer, A, B, D, C, E. The term for teeth that are present at birth. Answer, natal teeth. The term for teeth that erupt within 30 days of birth. Neonatal teeth. The significance of primary dentition space and arch continuity, maintenance of arch length, maintenance of normal facial appearance, sustenance of the child, normal speech development, general characteristics of primary dentition. Flush terminal plane, distal step, mesial step. The occlusal relationship where the edges of upper and lower teeth meet, resulting in class 1 occlusion. Answer: flush terminal plane. The occlusal relationship where the lower molar is positioned distally to the upper molar, resulting in class 2 occlusion. Answer: distal step. The occlusal relationship where the lower molar is positioned mesially to the upper molar, resulting in class 1, 2, or 3 occlusion. Mesial step. The normal spacing seen in primary teeth. Answer: interdental spaces. The teeth lateral to the canines. Maxillary. The teeth between the canines and first molars. And mandibular, the term for horizontal overlap of teeth. Overjet, the term for vertical overlap of teeth. Answer: overbite. The combination of primary and permanent tooth eruption occurring between 6 to 13 years old. Answer: mixed dentition. The period when a child's first permanent molars erupt, replacing their primary teeth. Answer: early mixed characteristics of early mixed dentition. Answer: flaring of upper anteriors, ugly duckling. Broadbent phenomenon, transient anterior crowding, end-to-end molar relationship. Anterior big teeth flaring in a small mouth, prone to traumatic injury, occurring in maxillary teeth only from 7 to 9 years old. Answer: flaring of upper anteriors, ugly duckling. The condition of having missing teeth. Answer: anodontia. The period of bone growth in children. 6 to 8 years old. A resultant distal divergence of the crowns of 2 central incisors that causes midline spacing, self-correcting by 8 to 9 years old. Answer: broadbent phenomenon. Minimal overlapping should occur, with coverage not exceeding 1/3 of the mesiodistal width in mandibular teeth only, 7 to 9 years old. Transient anterior crowding. The guidance of the distal surface of the primary second molar with no functional relationship of the first permanent molars. Answer: end-to-end molar relationship. The period when a child's first permanent molars erupt, replacing their primary teeth. Answer: late mixed dentition. The characteristics of late mixed dentition. Resolution of distal flaring, easement of transient crowding, leeway space. Due to the growth spurt of the mandible. Answer: easement of transient crowding. The difference between the mesiodistal width of the primary teeth and its successor. Answer: leeway space. The abnormal shifting of the first molar if the primary second molar is exfoliated early. Late mesial shift. The 32 adult teeth that replace the primary teeth in a person's mouth, occurring at 13 years old and above. Answer: permanent dentition. The sequence of eruption for maxillary teeth. 6, 1, 4, 5, 3, 7. The sequence of eruption for mandibular teeth. 6, 1, 2, 3, 4, 5, 7. The characteristics of permanent dentition. Normal overjet at overbite, cusp to fossa relationship, cusp to marginal ridge, cusp to embrasure groove. The normal horizontal overlap of teeth. 3 to 5 millimeters. The normal vertical overlap of teeth. Answer: 3 to 5 millimeters. Overbite. The normal range for tooth setting in terms of overjet and overbite. Prosthodontics should not compromise the following. Answer: 1. Palate, 2. Gingiva, 3. Frenum, 4. Tongue, 5. Lips, 6. Cheeks. The mortar and pestle relationship, indicating proper occlusion when a tooth's cusp tip touches the embrasure or fossa of an opposing tooth. Answer: cusp to fossa relationship. The normal occlusal relationship where the cusp tip of one tooth contacts the marginal ridge of the opposing tooth. Answer: cusp to marginal ridge. When a tooth's cusp tip touches the embrasure or groove of an opposing tooth. Answer: cusp to embrasure groove. Angles classification of malocclusion. Answer: 1 class 1, 2 class 2, 3 class 3. Classification of malocclusion. MB cusp of upper first molar is in line with the MB groove of lower first molar. Answer S1. Class 1. Upper first molar is more anteriorly located than lower first molar. Class 2. Lower first molar is more anteriorly located than the upper first molar. Answer: Class 3. Classes of functional occlusion. That 1. Physiologic occlusion. 2. Traumatic occlusion. 3. Therapeutic occlusion. 4. Static occlusion. 5. Dynamic occlusion. Definition of functional occlusion types: minimal muscle hyperactivity and limited stress to the system. Answer: physiologic occlusion. Disturbance in supporting structures of the teeth, muscles, and TMJ. Answer: traumatic occlusion. A treated occlusion employed to counteract structural interrelationship related to traumatic occlusion. Therapeutic occlusion. Upper and lower jaws are closed with an up and down motion. Answer: static occlusion. Movement of the jaw, particularly lateral bite. Dynamic occlusion. Dentist's nerve. Cranial nerve that supplies sensory and motor functions to the head, maxilla, and mandible. Primary sensory and motor nerve of the head, maxilla, and mandible. Provides sensory innervation to teeth, bone, and soft tissues. Motor innervation to muscles of mastication. Answer: trigeminal nerve. Arises separately from the sensory root, unites with the mandibular division to form a single nerve trunk. Supplies muscles of mastication, mylohyoid, anterior belly of digastric, tensor tympani, and tensor veli palatini. Answer: motor root. 3 divisions of the trigeminal nerve. V1, ophthalmic division, exits the skull via the superior orbital fissure. V2, maxillary division, exits the skull via the foramen rotundum. V3, mandibular division, Exits the skull via the foramen ovales. Answer: sensory route. Exits the skull via the superior orbital fissure, exclusively sensory, smallest branch. Supplies eyeball and conjunctiva, lacrimal gland, mucous membrane of nose and paranasal sinuses, and skin of forehead, nose, and eyelids. Answer: V1, ophthalmic division. Branches of ophthalmic division: 1, nasociliary nerve, 2, lacrimal nerve, 3, frontal nerve. Exclusively sensory. Supplies skin of face, nose, lower eyelid, and upper lip. Mucous membrane of nasopharynx, maxillary sinus, and hard palate. Maxillary teeth and periodontal tissues. Answer: V2. Maxillary division. Branches of maxillary division: 1, nasopalatine nerve, 2, anterior palatine nerve, greater palatine, 3, posterior palatine nerve, lesser palatine, 4, posterior superior alveolar nerve, PSN, 5, middle superior alveolar nerve, MSN, 6, anterior superior alveolar nerve, ASN. Innervates mucous membrane of anterior palate, premaxilla. Answer: nasopalatine nerve. Innervates mucous membrane of posterior hard palate and bone up to the first premolar region. Answer: greater palatine nerve. Innervates mucous membrane of soft palate and tonsils. Answer: posterior palatine nerve. Innervates buccal gingiva in molar region, pulp, periodontal ligaments of upper 6, 7, and 8, except MB of 6, and maxillary sinus membrane. Answer: posterior superior alveolar nerve. Innervates pulp and periodontal ligament of premolars and MB upper 6, gingiva, and buccal soft tissue in the premolar region. MSEN, N, middle superior alveolar nerve. Pulpal innervation to incisors and canines, periodontal ligament, buccal soft tissues, and bone. ASN, AAN. Mandibular division, V3, exits the skull via the foramen ovale, largest division of the trigeminal nerve, both sensory and motor. Answer: mandibular division. Sensory branches of the mandibular division: 1, buccal nerve, innervates buccal gingiva of mandibular molars. 2, lingual nerve, general sensation to anterior 2/3 of the tongue. 3, inferior alveolar nerve, sensory to mandibular teeth. 4, mental nerve, supplies skin of chin and lower lip. 5, incisive nerve, supplies mandibular canines and incisors. Motor branches of the mandibular division: 1, masseteric nerve, innervates the masseter muscle. 2, deep temporal nerve, innervates temporalis muscle. 3, medial and lateral pterygoid nerves, innervates pterygoid muscles. 4, mylohyoid nerve, innervates the mylohyoid and anterior belly of digastric muscle. Provides motor innervation to muscles of mastication and other structures like the mylohyoid muscle. Answer: mandibular division, V3. Travels within the mandibular canal, supplying all mandibular teeth. Answer: inferior alveolar nerve. Emerges from the mental foramen to supply the chin and lower lip. Answer: mental nerve. Supplies mandibular canines and incisors. Answer: incisive nerve. Motor branch that innervates the mylohyoid and anterior belly of the digastric muscle. Mylohyoid nerve. 1, relationship of how the upper teeth relate to lower teeth. Answer: tooth contacts. To occlude and fossa marginal ridges of opposing teeth well. Crush and cut food. Support the vertical dimension of the face. Centric landing pad for shear cusps. Answer: supporting stamp cusps. 3. Stamp cups of upper and lower. Answer: upper lingual, lower buccal. 4. Located in the embrasures or in the developmental grooves of opposing teeth. Shear the food to reduce it to smaller particles and act as grabbing cusps. Centric landing pad for stamp cusps. Answer: non-supporting shear cusps. 5. Shear cups of upper and lower. Answer: upper buccal, lower lingual. 6. Use of overlapping of the cusps. And it helps keep the tongue and cheeks out of the occlusal table. SAW 7, where the cusp comes in contact with the opposing. Answer: centric landing pad. 8. Tooth contacts ABC and its functions. Answer: A. Shear of upper to stamp lower. B. Stamp of the upper to stamp of lower. C. Stamp of upper to shear of lower. 9. How many contact points are seen for every occluding tooth? Answer: there are 3 contact points. 10. Contact points on an inclined surface. Answer: counter contact on another opposite inclined surface, reciprocation force to equalize occlusal surface. Factors and forces that determine tooth position when opposing muscular forces exert force. Forces stabilize the tooth in a neutral position. When one force is greater, teeth will move until pressure is equalized. Answer: during eruption. 12. Factors and forces that determine tooth position by muscle patterns when there is a habit like thumb sucking, external objects, and profession. Proximal occlusal contact. Answer: after eruption. 13. Imaginary surface that touches the incisal edges and cusp tips of posterior teeth. Answer: plane of occlusion. 14. Curved line from anterior to posterior. Answer: curve of Spee. 15. Curved line that runs mediolaterally. Curve of Wilson. 16. Left to right. Answer: sagittal. 17. Up and down. Answer: horizontal. 18. Front and back. Frontal.
What did you do on the mock exam? Share your score in the comments below. Thanks for watching. I hope this mock exam helped you in your review. If you want more dentistry, dental technology, and dental hygiene reviewers, make sure to like, share, and subscribe to John Ryan Magalona. See you in the next video. Keep studying and good luck on your exams.